Okay, you might have seen this beautiful young girl who had a lower eyelid blepharoplasty.
I know what you're thinking. What the?
So the second video is a little misleading. Cena is now the spokesperson for Neutrogena.
Oh my gosh, you can't see me. Can anyone see me? I just want to be seen!
Probably the most horrific thing I've ever seen is this video of a girl showing what she had, she's claiming is a radio frequency treatment. Okay guys, let's go over some hot and horrific YouTube and Instagram and TikTok videos that you may have seen on social media. And I'll give you my take on whether these are legit or they are just excruciatingly painful and you should not undergo these. Okay, you might have seen this beautiful young girl who had a lower eyelid blepharoplasty.
I know what you're thinking. What the fuck? Me too. So let me explain. These were what my eye bags looked like, and no matter how much sleep I got, no matter what product I tried, they were always there. So I wanted a lower blepharoplasty. This was me right before my surgery, and this was me immediately after. And in my pre-op appointment, he did tell me that my eyes would be sutured shut for 2 days, but I still don't think anything can prepare you for what that's actually like. They are sutured shut for optimal healing. This was me on Wednesday on the way to get them removed. I was so excited. He literally just snipped them and pulled them out, and this was immediately after. This was a little bit later in the day. This is the most bruising I ever had, most swelling I ever had, and this was on Thursday, only 3 days after the surgery. You can hardly even tell I had surgery, and this is about 2.5 weeks later. I'm extremely happy with the results, and if you're thinking about getting a lower blepharoplasty, 100%.
But the crazy part of this is when she shows her eyelids being sort of like sutured to each other. This is not, I will be honest with you, this is not a very commonly done post-operative care for lower eyelid surgery. But let me talk about why it's actually not a bad idea. So lower blepharoplasties can be done through the eyelid, through the inside here, so there's no external incision. But one risk of doing that is something called ectropion, where the eyelid everts outwards, and you don't want that to happen, or rounding, where your eyelid can go like this. And so to prevent that, sometimes surgeons will suture the eyelid to your eyebrow so that this eyelid is all the way closed like this. I know it's crazy, it's wild. But it keeps your eyelid from your eyeball from losing hydration, and it keeps it from dropping down. Now, is it gonna actually last very long? No, because you're only suturing it for a couple days like that. But I would panic if I had my eyelids sutured together, and you probably would too. So there are other things that I do, for example, just tightening up the eyelid after surgery to prevent that from happening, and just teaching your patients to tape and do other things to not have to suture their eyelid. So is it a legitimate technique? Absolutely. It's called a frost suture. Is this something I would recommend? No, there's just other ways to do it. Okay, so the second video is a little misleading. But let's first backtrack and talk about what she's doing. So this patient is getting what looks like liposuction in the neck, or double chin liposuctions, where you suck out some fat from the neck and jawline. Now, the first thing you have to do is to fill that area with fluid so that the fat actually comes out easily, it breaks up, and you're not running a cannula through a dry area. So you are going to look swollen, a little bruised, and kind of bloody right after this, because there's going to be blood from the incision. So this is not the ultimate result. It is a little bit of clickbait, or rage bait. Is it called rage bait? Whatever it is. It is something that will bait you into wanting to like freak out at this. And yes, while you're swollen and funny looking after the surgery, you won't look like this when the results are done. At 6 months, her neck and jawline are probably going to be pretty sharp and defined looking. But it also begs the question of why she had this done. So she goes on to talk about her being influenced by filters and the fact that this surgery was probably not needed for her. Even though she looks great and she's happy with the result, she questions whether it should have been done in the first place. And that's definitely something that you should do when you're considering cosmetic surgery. And it's something we actually talk about with patients. What's the reason for wanting this done? Does it bother you enough to undergo a cosmetic surgery? Because remember, these are elective procedures that will improve your overall general appearance, but they're not going to change your life per se. I think you're going to love your result, but you have to really want to have a surgical procedure for something you don't otherwise need. Okay, so Cena is now the spokesperson for Neutrogena.
Oh my gosh, you can't see me. Can anyone see me? I just want to be seen! Guys?
Your time is up, my time is now. You can't see me, my time is now.
Because he had skin cancer. So I actually think it's really great that celebrities are being more open about skin cancer diagnoses, because we know that sunscreen prevents UV damage And especially if you have lighter skin, you're more prone to having skin cancer. And skin cancer can show up anywhere on the body. It can be very disfiguring when on the face because you can actually end up with a tiny, tiny skin cancer that requires a giant area to be cut out, because those little skin cancers have little, we call them, some basal cell cancers are called morpheoform basal cell, and they can have these little tiny tentacles that reach all throughout the skin. So it can start out really, really small, end up really, really big. Those are rare, but remember that you can reduce your risk of having these skin cancers by wearing sunscreen, seeking shade, wearing sun protective clothing. And it's really great that these celebrities are, not just endorsing some cockamamie product, but actually something that works well. Probably the most horrific thing I've ever seen is this video of a girl showing what she had, she's claiming is a radio frequency treatment.
My left side is a lot worse than my right, but you can see that a lot of them are open. They weep.
They open.
I don't know what the device was, if she did it herself, because some of the comments sort of allude to the fact that she may have done this herself, or what this was. But I will say that these wounds that she has on her face are going to leave permanent scars. This is not radiofrequency microneedling. These are deep scars that have now gone through the dermis. So you have an epidermis and a dermis, and if you cut through the deeper layer of the dermis and into parts of the dermis, you're gonna leave a scar there. So that's why if you get a little scratch, these do not leave scars, right? It's through the epidermis, your body can heal it off. But when you get into the deeper layers, you are going to leave noticeable scarring. And she's got them all over her face. I have no idea what went on here, but this again goes back to the important thing of remembering that cosmetic treatments are not like getting your hair done. They're not like getting your nails done. They are not like getting makeup or lashes. These are medical treatments, right? They have real potential risks. You can completely damage your skin, your face, and you don't get multiple faces, you get one. So remember that the credentials of the person operating the device are arguably more important than the device itself. Because if they don't know what they're doing, then you could have the best surgeon in the world that destroys your face with just an instrument that they just don't know how to use. So same reason why you need a license to operate heavy machinery, you should have a license and the proper credentials to operate devices like this, even if you can get them online. Do you guys like series where I talk about hot topics and hot and horrible and horrific things? If you do, let me know in the comments, and don't forget to like, subscribe, and follow for more. I'll see you next time.